Hi, I'm Dr. John Young, Medical Director here at Foundational Health Center here in Largo, Florida. Today we're going to be talking about autism. And I think of when I first got into medicine back in the late 80s, early 90s, not a lot about autism because it was starting in some of the literature to be, more prevalent and reading about it. The other thing with autism is there's no one treatment fits everybody. It's not like strep throat, here's some penicillin and you're going to be fine. But I remember back there in the 80s and 90s, there was a number of people going around saying, listen, it's heavy metals. And so these people are preaching, we're going to get all these heavy metals out of these kids and all the chelation and all that, which is fine, but I was meeting some of these kids and I didn't see that much improvement. Some got better, others didn't. Then it was vaccines. Vaccines are the reason for autism. And I think there is very strong evidence that vaccines are relevant in looking at autism. But then I also had patients that had no vaccines and were dealing with autism. And then it's, we've got a methylate, they have an MTHFR factor, and do this, and stay away from this foods. And all this stuff is great, but there's nothing that I've seen that's 100% in autism. Until recently. And it's really not in a lot of literature, it's out there, but once you get into the real nitty-gritty of what is actually happening in the brain of these autistic people, that's where you start to realize that they all have the same thing. And the studies really started back in the early 20s, 2021, 2020, 01, 02, 03, 04. But now what we're seeing is that in looking at the brains after, autopsies and all that, all of the autistic brains had the same problem: a thinning or a lack of insulation along the neuron, along the brain nerve. In other words, if you have two wires touching each other, you're going to short it out. That's why there's insulation along the wiring in your house, and also insulation along all the neurons in the brain. And so what they noticed is there was areas of very little insulation and areas of no insulation. The other thing they noticed is they all had a protein called alpha-synuclein protein. And by following the amount of alpha-synuclein protein, alpha and gamma, that they could determine how severe the autism was. Now, you aren't going to get that from LabCorp or Quest. These are special studies that are done at universities and all that. But those two things, as far as we've seen so far, seem to be 100% with all the autistic community. Now, what we've been doing, which is kind of exciting, is looking at how can we repair that neuron, and what are you going to do with the alpha-synuclein protein? Because that protein, it increases as the child gets older, and it damages more and more neurons and doesn't allow the body to remake the insulin sheath along the nerves. And it also messes up the potassium channels in the nerve. And it's the potassium channels that have to do with the strength of the electrical message. Because this electrical message in these kids' brains is being garbled. They have trouble speaking, or they just socially can't do what needs to be done here in our community, or what we expect from a normal person, because their electrical system is way, way off. So there's been some great studies, and we do a lot of stem cells. And stem cells are very interesting in the autistic. Number one, they do repair. They can repair the neurons. Number two, they help build new myelin sheath. And they can also work on the potassium channels. But there's some subsets of that cord tissue that also have a lot of what we call exosomes and other products that are very specific for the alpha-synuclein or the beta or the gamma-synuclein protein, to get rid of that, because that's always gumming up the works. So more and more, and as I talk to the patients, and I also see this in other neurodegenerative diseases, that if you can get rid of a lot of that protein, that these patients do better. Number two, we've started using 4-aminopyridine, an old drug. It's been around since the 1960s that people forget about. But what it does is it works on those potassium channels in the neurons to repolarize them, to allow them to conduct that strong electrical message down the nerve. And even doing it with my own daughter, who does not have autism, but does have Downs, which also is a potassium channel problem, starting to see things that we haven't normally seen. And so in just looking at what we know for sure is that alpha-synuclein protein is very, very damaging, and it's in all these autistic kids' brains. And there's always, when you have that protein, you always have a potassium channel problem. So you're going to have a problem controlling the amount of electricity that goes through that nerve, which is what the brain is all about. It's an electrical machine. That there are some very specific things that you can do to really turn things around. And we've just been really surprised, very pleased with what we're seeing. You can talk to your doctor. If he's familiar with 4-aminopyridine, you have to know dosages, when to start, when to stop, things like that. But we have been seeing some great results, and just wanted to share that with you, is that there are some definite markers in all of these people with autism that we really have stuff to work at to repair those areas.